Hello, my name is Brittany Kirkhope and today I'll be conducting a health check. I will be using this cat for my health check. He's actually my cat and he's called Benson. So usually when you handle any animals, especially a new animal, you need to make sure that they're comfortable with you and maybe like give them a few minutes to get used to you before you jump right in. With him being mine, I can handle him a little bit more, however he's in a little bit of a huff today, so that is debatable. So first of all, it was his birthday yesterday. He's just turned 6, so there shouldn't be any age-related health issues that we need to look out for with him being at like a nice healthy age. With doing a health check, what you want to do is you want to do like a body condition score. So you just always, as you're stroking him, you're feeling for any lumps, anything. You want to be checking his fur. He's got a nice healthy coat, and then you want to do the check from front to back. So I'll start off. First of all, you want to look at his eyes. He's got nice clear eyes, no signs of discharge. Then you want to move on to his nose. There's no runniness in the nose, and that's fine. So yesterday he did have a little bit of an injury, which has seemed to go away, but this was on his mouth, so he's not negotiating very much with checking his mouth. However, sorry. You can see none of his teeth are snapped from there. He's got nice healthy pink gums. And the swelling on his mouth has actually seemed to go down. It was a little bit swollen yesterday. So that's the front. You also want to check in his ears to make sure there's no ear mites or anything. So as I can see, these are nice and clean. He's got nice clean ears. So from this, then obviously you want to be working your way down. You're still just feeling for any injury. You want to check that the limbs can move okay. Front to back. He isn't in any pain, he's just in the huff. So yeah, as you can see, I would say he's at an ideal body weight. He should have a smooth tucked in waist. You should be able to feel his spine, feel his shoulder blades a little bit, feel his ribs, feel his hips. You want to be able to feel everything, but it has to have like a nice little layer over the top. You don't want any protruding bones. If there's any bones on show, then that's too thin. So you need to keep an eye out for that. Also, another thing with the cat is they need to have a little bit of a fat pouch underneath the belly. This protects the internal organs when they're jumping and climbing and things like that, so that's vital. If your cat is too large, it will have like a very round belly and you won't be able to feel any of its bones. That's too big and that can cause joint problems further down with obesity. Obviously when your cat's jumping about, all the extra weight. Right, I'm sorry. You can see he's got nice healthy fur, he's got nice shiny fur, there's no dry parts, there's no dry skin or any bald patches or anything like that. So I'm going to work my way down. So Benson is a neutered male. So as you can see, he's been castrated. He's got a nice clean bottom end. So that's a nice healthy overall. Obviously with him having his mouth injury yesterday, injuries are something that you need to take like a lot of care with to assess whether you need to take them for further examination from a veterinarian or anything like that. So the oral swelling is not normal in cats, that's why it's something that you have to keep an eye out. Obviously with him being outside, as I've mentioned earlier, he gets into little bumps and scrapes and fights and things. So it's not uncommon for him to have these small injuries, but they do usually just go away on their own. The swelling is just your body's natural immune response. It's the white blood cells, which are also known as leukocytes, rush into the area in an attempt to heal whatever's gone on there. It's just trying to help really. So obviously with that being swollen yesterday and it's went down today, that's not something that we need to be concerned of, but obviously I need to keep a check of make sure that no swelling comes back up. So also another thing that came into legislation just last year, it's a very new law, is by law all cats now need to be microchipped. Where's it at? There. So this is Benson's microchip number. You can be fined up to £500 now if you don't follow this law. So it was the 13th of March 2024 when the law was ruled, and you were given until the 10th of June 2024 to have your cat microchipped before the repercussions of not following the law came into place. I know you're alright. So yeah, just like I say, you need to just make sure that you can keep the animal comfortable at all times. He doesn't like staying in one place too much unless it's of his own accord. So this is usual Benson behaviour for Benson, as is with many other cats. One thing that you do need to know is you need to know if you're doing the health check on another animal and it's not actually yours. You need to have a bit of background about the normal behaviour of cats. Usually when they're in pain or injured, they can hide more or become more aggressive and want to see you a lot less. But obviously some cats are just like that anyway, so you need to know what behaviour is typical to your animal and what isn't, and that can give you a much better insight into what might be going on. I know he's calmed down a little bit now. So another thing that you need to take care of with cats is cats are prone to a few diseases, so this is something that you need to keep an eye out for. They can catch things like cat flu, they can have diabetes, they can get feline leukemia virus, and many people think that parvo is just a dog disease. Feline parvo is actually a thing as well, and they can also catch chlamydia. Another thing is if the teeth are broken or mouth infections, that can cause internal issues later on. So it's very important to make sure that you're keeping on top of your cat's oral health as well, and if there's any issues you need to take them to be checked properly. So if the cat was to have, for example, cat flu, this would cause runny eyes and runny nose. That's something that you need to keep an eye out for. Cat flu is just like human flu, but obviously it is something that needs to be treatable, because in like very bad cases it can lead to death. I know. Diabetes, any signs of diabetes, your cat will get thin and it'll lose weight fast, and it may start eating more or drinking more frequently. I know with Benson, some of the behaviours change seasonally, so he's a lot more active in the summer and he doesn't tend to eat as much, whereas he eats a lot more in the winter and sleeps more. So that's normal behaviour for him. However, if he was to do that in a time when I wasn't expecting it, then that would be something to worry about or keep an eye on and getting checked out. Hello, so as stated previously, the most important part of doing any animal health check is to make sure that your animal is comfortable and they're happy for you to take part in the procedure. With Benson having a mild injury from the day before, he was a little bit sore, and checking in his mouth, as that was where he was injured, he sort of wasn't cooperating very well, so he's had a little break. We've came back to do the final things. He's in a much better mood now, so he should be okay to continue. So first of all, I would like to say fleas, ticks and worming as well. That's one thing that's so underrated and important to keep up to date with. Fleas and ticks are a large disease spreader, so that's something that you want to eliminate, as you don't know what they're passing on to your cat. With him being mine, I know that he's up to date on his vaccinations and he's wormed and fleed, so that's not something that I need to be worrying about. Other things as well is cat flu, for example, can be caught when they're outside by other cats. He would have a runny nose and runny eyes, so as you can see, he's got a nice healthy face. There's no signs of any form of illness or anything like that. His face has went down, his little injury, he was swollen on one side, but the pain must have gone. He's been a lot more manageable and he doesn't mind us touching his face, so that indicates to me that that small injury's healed itself. Cats can also catch chlamydia from each other and things like that, so with that what you would be expecting is very yellow snotty eyes, so that would typically be treated with eye drops. However, it depends whether the virus is spread to other areas or like how long the cat's had it for. It may also need a course of antibiotics for that to be treated. There's diabetes as well, which cats are very prone to, with this you would be needing to look out for if your cat was eating more, drinking more, sleeping more than normal. And a severe, like a drastic weight drop would also be something that you would need to worry about. If your cat had these signs, you're best off taking them to the vet as they need the bloods done to determine the cause of this. And also feline leukemia and things like that are diseases that you need to be looking out for as well. Many people think that parvo is something that they would associate with dogs. However, feline parvo does exist, and it is a very dangerous disease as well. So that's something that you need to be keeping an eye out as well, especially if your cat goes outside.